Welcome to Culpeper, a town and county unlike
First, welcome to the Combined Neighborhood Watch and Amazing Citizen Award. My name is Lieutenant Ashley Banks with the Culpeper Police Department. And again, I want to say welcome. We have a great presentation and a great award recipient of the Amazing Citizen Award. First, I'd like to thank a few people here in the audience. Town Manager Chris Hively is here with us. Vice Mayor Billy Yao. You turn the lights down, it's hard for me to see people, but Councilmember Frank Reeves is here. Councilwoman Megan Taylor, Keith Price, Prentice Ramikis, Jamie Clancy is here. John Russell's here. I think that's all the council members. I think Keith Price is in the back. Hey, I apologize. And see, the lights came back up. Also, I'd like to pay recognition to Jim McGrath, who's here with us, the director of Rappahannock Rapidan Community Services. If you remember our last meeting, he was our guest speaker. Lisa Peacock is also here, who is the director of Culpeper Human Services. Junior Perryman's in the back. Spoke to him earlier from Company One. Also, I'd like to thank Pastor Dan Carlton, and again, for the Baptist Church for allowing us to hold our meeting here. I think that was all the introductions, and we'll go to a short video before the chief and the major come up to present the award to our amazing citizen.
Pastoral views, a vibrant downtown, where destinations and activities abound. There is one aspect in particular that helps Culpeper rise above the rest: the people. Every day, all over the community, people are working to make a difference.
In Gladys's case, the description as an amazing citizen is perfect.
Someone that goes above and beyond their normal routine, their normal job, things that they're not asked to do, they just do it. Don't expect any type of reward for that or anything. They just do it because that's their nature and that's what they want to do.
A lot of things they do can be behind the scenes, but at the end of the day, what they do makes a difference in somebody's life.
Gladys is a remarkable person. She is amazing, and she has such a big heart, huge heart. And we appreciate all that she does in the community. It wouldn't be the same without her. And we have much gratitude.
Gladys is the Senior Center Administrator for our Culpeper Senior Center.
Well, I think her hard work to get the new building and the new facility that she's in now exemplifies how hard she has worked for Culpeper.
I remember walking one very early morning at Yale Meadow Park on a Sunday and heard a familiar voice over a loudspeaker. I thought I was hearing things. I looked around, saw Gladys Williams meeting a church congregation to let them know of her plans of renovating Culpeper Senior Center. I immediately started laughing as she didn't care what it took. She was going to give her all to reach this goal. Even early on a Sunday morning, she was there. She was determined.
I went to a Board of Supervisors meeting and did my best to explain the program, the grant, what it was all about. One of the supervisors said, "Does this relate to Gladys Williams' program?" And I said, "Yes, it's exactly about Gladys Williams' program." And he said, "Well, why didn't you say that to begin with? Of course we'll approve." So that kind of told me all I needed to hear about Gladys's impact in the community.
Well, I know probably a couple winters ago, we had the bad snow, as you called it, a bad snow. I know there was folks, seniors out there that didn't have power. Of course, obviously didn't have food or could get their medicine and all. And I know she went out and made deliveries and tried to get as many as she could, their medicines or food or water or whatever they needed. And she does that all the time, and she doesn't ask for nothing. She just does that. That's just Gladys. I mean, that's what she does.
Unbelievable during this pandemic and everything, what she's been able to keep how she's kept things going. You know, they would close, they would open, they'd close back up, open again, but she kept the communication going with all the seniors by either calling them, checking on them, making sure they were all okay,
and such a loving person, truly a loving person. It just emanates from her.
She just wraps her arms around you, welcomes you in, and makes you a part of the Culpeper Senior Center family, and it's a tremendous gift that she has.
Someone that you could just walk up to and you're going to get a hug every time you see her. And I certainly think a lot of her and what she's done for Culpeper.
Her personality is just the sweetest that I've ever met. You know, like I said, she's like everybody's favorite grandmother or favorite aunt, I guess you'd say. She's just the most giving person I've ever met.
It's hard to imagine that she receives more than she gives, because she gives a lot.
You know, she's always looking to help someone and try to accommodate before herself. She always puts everybody before herself, and which is no pun intended, but I mean, that's amazing in itself. And so, yeah, she's a special person.
Gladys was the first person I ever met in my job, and I'll just never forget. I had moved here from Northern Virginia, and Culpeper was just, really out there to me. I live at Lake of the Woods, and she was the first person I met, and just what a sweetheart. She's just, I'll never forget when I left, she's, "I love you." And I was like, okay, that's different. And then it's like I've become to where I expect it, it's just, that's her thing. "I love you," right when you leave and walk out.
I asked her why those are her last words at the end of any conversation. She told me she wants to make sure they know they are not alone, and also wants to make sure that she tells them she loves them, in case that's the last time she gets to speak with them before passing on.
And she tells me every time, if she hangs up the phone with you, "I love you." And Gladys, I love you.
She makes us shine at RRCS, in our communities, and with our most important generation, our older adults. Thank you, Gladys Williams. You deserve this amazing citizen award, and I love you.
It's hard for me to speak right now, but I want to say thank you, thank you, thank you. And all the credit goes to you guys, because I couldn't have done it without you. Without the support and love that we have in this room, we could not do what we're doing. So thank you. Thank you.
Thank you, Johnny Krawchuk, for that amazing video. The only bad part about coming after the video is that all the words and all the things you want to say just got said in the video, and I can't think of anyone or any words that can exemplify the impact that Gladys makes to this community every single day, making a positive impact in people's lives. I learned two things as the police chief a long time ago, is that, first of all, if Gladys Williams calls you, you answer the phone. The second thing I learned is that anything she asks you for, you absolutely don't say no. And I do that very well. Right, Gladys, I hope? Yeah. Yeah. So she doesn't mind calling and reaching out and advocating for her seniors, and she really is truly an amazing person. And Gladys, I love you, but you know something? The whole community loves you, Gladys, and this is really the whole community right here. So Gladys, this is the time we have to ask you to come up here on this stage. We're honored to have you on the stage with us and present you with this amazing award. Give him a hug.
How are you? I already hugged him.
Now, I don't have my glasses on, so that's my excuse.
Okay.
I'm going to try to read this.
Okay.
It is with great honor to present Gladys Williams with our Amazing Citizen Award. In recognition of your endless effort dedicated to community outreach and involvement. The Culpeper Police Department and the community we serve appreciate your dedication and unconditional support. Your commitment to community service truly epitomizes what makes you an amazing citizen. Gladys Williams, congratulations on this outstanding accomplishment, and I'm so pleased to give this to you.
Thank you so much.
Now, I have to point out that the folks in our businesses, great community, as we all know, that sponsors this evening, and they would all like to share a little something with you as well. So,
Okay.
Green Roost is right on top here. I love going to Green Roost because they gift wrap.
Oh.
And
I love going there too.
so on behalf of Green Roost, congratulations on the Amazing
Well,
Citizens
thank
Award.
you.
I'd like to
Thank you so
present
much.
that with you.
Okay. Let's
Uh,
set this.
Now, one of my favorite places is right across the street
Oh, Knackles.
from Green Roost, and that's Knackles. I would recommend the Bismarcks there, personal
Okay.
favorite of mine.
Thank you so much.
Just enjoy that.
Thank
Yes,
you.
yes. Moving Meadows, right there at the old State Theater.
Okay.
One of my favorites, best cinnamon buns in town. Go there and
Thank
try
you very
those.
much.
Yep, so appreciate that.
I'm gonna get that. Gotta watch my schoolgirl figure.
Well, and if you ever drive down Main Street in Culpeper or South Main Street where the old Kentucky Fried Chicken used to be, for a few of us that may remember that, is the Shenandoah Garden spot. Boy, isn't that beautiful? And
Oh,
they're
yes,
transforming, make it
yes.
really feel like it's,
Greg's a super person.
yes,
too.
makes it feel like it's fall in the air. Feels like it tonight. But here is a gift certificate there to go by and get
Thank
you
you.
something for yourself. For yourself, Gladys.
Okay.
And the mom. And the mom.
Hey.
Oh,
and
the
thi-
mom.
and-
Ooh.
And the mom comes along with that.
Whoa,
So,
beautiful.
and that goes to you.
Okay.
Yeah.
Promise.
And a place that I know that really supports your program as well, and you, is It's About Time.
Yes.
John Yarnell, and they would like you to come and dine on
so
them.
much.
So,
Check this out.
So-
My goodness. Special.
well, you should. So, again, congratulations on all you do for our community and being recognized this evening. And the microphone is yours. I know you've never seen a microphone that she even got her own notes prepared. Yeah.
And I want you to know that it's done on freebie paper too. Okay. And actually what I want to say is thank you very much. And it's really you, the people in this community, is what has helped us to get where we are tonight. Because without you, we could not do any of this. So I want you to give yourselves a hand because it's you that is the reason for this award. And I want to say thank you so much. I'm so grateful, and I love you very much.
I'm sure some of these uniformed folks will help you, Sergeant Caruso will help you with all of this, but at this time, we'll turn it over to Major Settle. Or Ashley?
So we're going to take a little break. We're going to have to take some time for Gladys and her staff and her family, and everybody else can take pictures. And please help yourself. There's still food in the back, right, Rebecca? Also, thanks to the ladies in the back for help serving the food tonight, too. So we'll take about a 5 to 10 minute break to get some pictures, and we'll reconvene our Neighborhood Watch agenda shortly. Got a great program. April Achter here is from the Health Department, BDH, and she's going to give you all the information you need to know about what's going on. Not much going on in the Department of Health these days, so she'll let you know what's going on. All right. Check. I've been told I got to go ahead to start our program. I'm the lucky person that gets to start the program off, and I think I get to do the funnest part of the program tonight. And we like to introduce our new officers to our community. It's important that all of our officers are known in our community, and our community knows our officers. So our two newest officers I would like to bring up and introduce to you guys, and hopefully you guys can get to know and have a few words with them after the program tonight. So Officer David Munn and Officer Joel Davis, come on up. I'm going to ask Sergeant Jacob Neal to come on up too. Where's he at in the back? Yeah, I'm going to ask him to come on up too. He's not on the agenda, but yeah. Now I really feel, gotta stand behind me. And we'll get started. First of all, Officer David Munn, who's standing to my left here, he lives here in Culpeper County, lives in the Boston area, lives with his father and his girlfriend. 24 years at the Arlington County Police Department. So he has served a career. He has been a public servant for 24 years and up in Northern Virginia, Arlington. We're lucky to have him serving here in our community in Culpeper and in the community he lives in. I will tell you, he brings a lot of wealth of knowledge, training, skills, and schools to us. And I will tell you, an officer like David Munn is certainly invaluable to any organization. So I'd like to introduce Officer David Munn. Next up is Officer Joel Davis. Joel Davis just came to us maybe 2 weeks ago. Officer Davis comes to us from also Arlington County Police Department. He has about 10 plus years up there, was a corporal. Again, has a lot of skill sets for us that's invaluable for a small agency like the Culpeper Police Department. He brings in a wealth of knowledge of serving in Arlington County. And he lives right here in Catalpa area of Culpeper County, lives in the community, has 2 small children, and he is invested here, and we're lucky to have him. And it's lucky for us to be able to recruit 2 officers from Arlington County Police Department. When I thought we can do that, from Warrington and Fairfax, it's only a testament to our agency, a testament to our chief, to our town manager, and to our town council for bringing a benefit package that we can recruit guys like this. So, Officer Joel Davis. And next up, now on the agenda, we have Sergeant Jacob Neal here. Jacob Neal has been an officer with us for about 5 years now. Went through our recent promotional process, and last week he was notified by Chief Chris Jenkins that he's been promoted to sergeant. So he's a detective now, so he'll be back in the uniform on nights, patrolling your street. He got promoted tonight, so yeah, he gets to. I'll tell you, that's the kind of way it works, but I would feel safer at night. I feel safer at night going to sleep at night knowing officers like Sergeant Neal were on the street protecting our community. And we look for great things for him, leading our young men and women out here in patrol. And he has a small child, just had a baby, lives in Orange, and I feel his pain there, as having a baby myself recently. So we're kind of in the same boat there, but congratulations to Sergeant Jacob Neal. Now, I'm really going to put him on the spot and ask him, do they have any words of wisdom for everybody?
Speech? I defer to the sergeant. I told him to have 10-minute speeches prepared, but nobody has. No, thank you all for coming out tonight, and I appreciate it, and looking forward to hearing from everybody and get a chance to talk to everybody.
Thanks, guys. Uh-oh. If you don't mind, what do they look like? Oh, yeah, take your mask off, guys. Wow, I didn't know that's such good-looking guys. Wow. Jacob, put your mask back on, man. Yeah, put mine back on, too. Thanks, guys. Appreciate it, and thanks for coming out tonight, and we look forward to great things from you guys. Thanks again.
So we'll go ahead and continue with our program. I'd like to introduce our guest speaker, April Achter, MPH. April serves as the Population Health Coordinator and Epidemiologist in the Rappahannock-Rapidan Health District. Prior to this, she spent over 14 years working as a field epidemiologist at the local, regional, and state level in Virginia, as well internationally when her family was stationed overseas. Her background also includes conducting research and teaching at the university level. She holds a master's of public health from San Diego State University. Ms. Achter will be speaking on COVID-19 updates in the Rappahannock-Rapidan Health District. With that, Ms. Achter, would you please come up?
Does this come undone? The light is really bright. Well, thank you for having me tonight. I'm always happy to come out and talk to the community. We're going to talk about a little thing that you've probably heard of in the last few months called COVID. I'm ready to talk about anything else, but that's what we're going to talk about tonight. Thank you. I'm a pretty informal speaker, so if you have questions as we go along, I'm happy to answer them. Just raise your hand and we'll address them as we go. Next slide, please. So when it advances, the next slide just shows our leadership team. So I think I'm the person that's often out in the community talking, but we have an entire leadership team that is working, and I think we have one member here tonight. Her name's Gladys Hatter, if you'll raise your hand. She's our emergency coordinator, and we often joke that we have seen more of each other than anyone else over the last probably year and a half. It's okay. I can keep, yeah. We have a person back there. Are they just not advancing? It's all right. I got him in front of me. All right, well, I'll keep talking while they're working. And so if you could see the next slide, what it shows is a picture of the United States, and it shows where we are right now with our level of disease transmission. You really don't have to see the slide because the reality is most of it is red, right? Most of our country is experiencing what we call high transmission. We had hoped that we would be at a lower level right now, but Delta has really changed the game for us. It's more transmissible, means it's easier to spread from person to person. The patients that have Delta have a higher viral load. And also, the way it was described to me is it's stickier. So when the virus gets in our body, it attaches to a receptor. And it was described to me like our first version, our first strain of COVID was like kindergarten glue. We're talking about Elmer's glue. And Delta is like Gorilla Glue. And I think that's a good description and helps explain why it has spread so easily in our community. No luck, huh? So the next one, if you could see it, talks about how many cases we have in Virginia right now. And, oh, maybe. So as we talk about Virginia and as we talk about our local health district, we're really in the same boat. We have an increasing number of cases. We have hospitals that are nearly full. We have public health staff and we have hospital staff and our doctors and nurses and everyone in the community that are really, really tired. We are running a percent positivity of probably 9% in our health district for PCR test. That's the send out. Our rapid test, though, is running at an almost 15% positivity. And another slide you can't see, it's just a graph of all of our cases. And so if you look at it, there's a peak around December, November, or December, January, where we thought we were at our surge, and then it drops back down over the summer, and then it increases again, and we aren't quite at the level we were in January, but we are very, very close to that level. And so what does all that mean? If I've set the stage that we have increased transmission, we aren't at a place where we want to be in our community, what do we need to do? And the reality is we need to go back to basics. When COVID first originated, the only things we had to do were what we call non-pharmaceutical interventions. So masks, hand washing, keeping your distance, and staying home when you're sick. All of those things still work, and at the point we are now, we need all of those mitigation strategies for now. Okay, it won't be forever, but until we get through this surge, we need to go back to basics and do all of those things. The thing that's different now than before is we also have vaccine. And so these cases that you're seeing, everything that's lighting our maps up in red, this is an outbreak of the unvaccinated. So these vaccines we have work better than we could ever have imagined. We just need to encourage more people to get them. Yes, ma'am. So most of what we're seeing, I heard 3 questions in there, and I'm gonna try to answer all of them. Most of what we're seeing in our community is Delta. It's the new strain. I actually do have those numbers because I figured I'd be asked, and I wrote them down because I couldn't remember. We have vaccinated almost 5 million people in Virginia. Of those people, 0.5, so 0.5%, have developed COVID. 0.019% have been hospitalized. This is of those vaccinated. And 0.0046 have died. And so if you have a natural infection, you can get COVID again in the same way that you can get flu. So a lot of these respiratory viruses, when they replicate, when they make copies of themselves, they are quick and they're sloppy. And so the copy is a little bit different, and that's why you can get infected again. The vaccine actually gives you better protection because it teaches your body to develop antibodies to different spike proteins, and so you have better cross coverage than from natural infection. But nothing is 100%. So absolutely, even though our vaccines work really, really well, we could see someone who is vaccinated that gets sick. The important piece of that is most people that get vaccinated, if they do get sick, they are very mildly ill, right? And so from the perspective of these vaccines are keeping people out of the hospital, these vaccines are keeping people from dying. And that's why we did all of this. The reason we put all these measures in place is because the case fatality rate, the rate of people dying, was so high. Did that answer your questions? Okay. So I think there's a couple questions in there as well. And so we, the independent group met last week to talk about the boosters, and they voted yes to boosters for certain populations, and one of those being folks that are 65 and older. And the reason they voted that is they were concerned about immunity waning with Pfizer after 6 months, and that booster would help give you more protection against getting infected. And so the direct answer to your question is, could you get COVID after getting 3 shots of vaccine? Theoretically, yes, but the risk would be really, really, really low. Oh, that's my favorite.
Did you say 6 months for the booster? I had read it was 8 months.
So when it was being discussed, it was 8 months, but when they voted on it, they voted 6 months. But we don't have guidance yet. So the next phase here is once this independent group votes, it goes to the CDC and ACIP, which is the American Academy on Immunization Practices. They give us direct guidance on what to do. And so that's where doctors and public health take the instructions for who gets it and when and what spacing between. And I think it will be 6 months. That's okay. Most of the time when we talk about vaccinations, there's a minimum interval, and so you can't get it before a certain date, but especially with a booster, if you get it after, that's okay. Are they advancing now? Maybe? So Pfizer's the only one to date that has been approved for a booster. Moderna, we have to wait and see what happens. They actually met today, and so the guidance may come out tomorrow. I don't know what the answer will be yet, but when they've done studies, Moderna is actually a higher dosage of that type of vaccine, so it seems to be holding immunity longer. So the best practice is that if you start with Pfizer, you stick with Pfizer. If you start with Moderna, you stick with Moderna, but their recommendation reads that if one of those is not available, you can get the alternative.
Are you speaking strictly for Virginia, or are other states having different protocols?
For the boosters,
Yes.
that'll be federal. That'll be across the board. So it'll be a CDC recommendation that goes out across the country. So when we get through some of the slides, what is recommended right now is that if you fit certain criteria, you can get an extra dose. And what that means is if you are immune compromised, you're taking high doses.
Yeah, so you're saying there is an if what?
There's an if what, but it's different. A booster is given because it's thought that your immunity has waned over time. This third dose is given because for whatever reason, the provider has reason to believe your first 2 doses might not have given you enough protection.
How about the flu shot? You're talking about now giving the flu shot already?
So flu shots are already out. I got mine this week. I encourage everyone to get their flu shot this year as we're out and about and in larger groups. Last year, we didn't see flu at all, hardly, right? I mean, that's pretty good evidence that our masking and our distancing worked. This year, we don't know what will occur. You can get your flu shot at the same time you get a COVID shot. Can you keep forwarding for me? Keep going. Keep going. This one. So this is something, you know, masks are sort of a hot button issue in a lot of places. And I don't know why, but I'm public health, right? It is in my blood. I've done it my whole career. And every time we investigate a disease, we have certain interventions we put in place to reduce the spread. For a respiratory pathogen, masks are effective. So because we are in an area of high transmission, the CDC recommendation says that we need to have our mask on indoors. There are some places where masks are required. Those include healthcare facilities, in a public or private school, and public transportation. And a school bus is included on that list of public transportation. Next slide. So this one shows what happens and what we do at the health department if you have symptoms and you're sick with COVID. And we have case investigators and contact tracers that are working 7 days a week. When we get a case reported to us, the first thing we do is figure out, does the patient have symptoms or not? And so if you're exposed to COVID, your incubation period would be the date that you were last in contact with a sick person, 2 days from there to 14 days. That's your incubation period that you could possibly get sick. If you get sick, we have to calculate what's called your infectious period. So when could you give it to someone else? So if I had symptoms, we would go back 2 days from now and 10 days forward. If you don't have symptoms and you get a test because you're going to travel or because you've been close contact, we calculate your start date for isolation as the day you got the test. You can be released from isolation when it's been 10 days from your onset or date of test, when you have been at least 24 hours without a fever, and when you show clinical improvement. You don't have to be 100% better. You can have a lingering cough. You can still be a little bit tired, but we have to have documented clinical improvement, and then you can go back to your routine activities. Next slide. So what makes us call folks as a close contact? If you are within 6 feet of another person for more than 15 minutes, and as an adult that's with or without a mask, you're considered a close contact, and we're gonna recommend that you quarantine for a period of time. And I'll cover those on a different slide, but isolation is separating sick people so they don't spread disease. Quarantine is separating folks that are well, but that have been exposed to the illness. You're also a close contact if you've got direct contact with respiratory secretions. If your child sneezes on you, if you have kissed, if you've shared eating utensils or drinks, you're a close contact if you live in the household. With our first investigations, when we first were working with COVID, most of our cases were in household contacts. Delta has really changed that, and we're seeing a lot more spread with less interaction involved. Next slide. There is an exception in public school to our close contact definition. If your child is in a public school, and if they are wearing their mask, and everyone is wearing a mask, the spacing goes down to 3 feet. So if they are farther than 3 feet from each other and everyone's wearing their mask, they don't have to quarantine. Next slide. So the CDC came out with options for quarantine. And they did that as a way to try to help people get back to work and school. And they based it on a risk analysis of how likely you are to get sick after a certain period in your quarantine. The gold standard for quarantine is 14 days because that's the incubation period for the illness. The next option is if you do not wish to test for COVID, you can be quarantined for 10 days and go back to work or school on day 11. The shortest option is what's called a test-based strategy. So if you've been exposed and you're on quarantine, if you get a test between day 5 and day 7, you can go back to work or school on day 8 as long as your test is negative and as long as you don't have any symptoms. Next slide. So who doesn't need to quarantine? Spoiler alert, I'm gonna promote vaccine, right? You don't have to quarantine if you've been vaccinated. You also don't have to quarantine if you have had COVID within the last 90 days. If you're fully vaccinated, though, we ask folks to monitor for symptoms. For the 14 days, we ask them to wear their mask at all times when they're indoors, and it doesn't apply in certain situations if they're an inpatient or in a healthcare facility, because most of the time, those folks are very high risk. Next slide. Our best way to move forward, right? Our best way to get back to all the things that we are missing and that we want to do is vaccination. These vaccines have performed with an efficacy that we couldn't even imagine. There are lots of ways to get a vaccine. You can use any of those techniques that are listed. There's phone numbers, you can do vaccines.gov, you can text Get Vax, you text your zip code to that number, and it will give you options of places to get vaccinated. Next slide. So one of the things I heard for a long time is, well, I don't want to get a vaccine, I'm nervous about it because it's under emergency use authorization. I have great news. Pfizer is now fully approved for ages 16 and up. For the younger age group, for 12 to 15, it's still under what's called the emergency use authorization. Next slide. So this is what we were talking about, is for certain groups, the third dose has been approved. The list is on the CDC website. It's for those that are moderately to severely immune compromised, and they would like you to stay with the same manufacturer. So if your first 2 doses are Moderna, their recommendation is to get Moderna for your third dose, but it's not a deal breaker. If that's not available or for whatever reason you can't get it, you can flip as long as it's an mRNA vaccine. There is a minimum day though, and so let's say if you get Pfizer, you had 21 days between your first dose and your second dose, Before you get your third, you have to have a minimum of 28 days. Next slide. The booster doses is what's on everyone's mind. I think we talked about it during one of the questions. We're waiting for guidance, right? So it's been voted. They voted yes for over 65 and certain health conditions and potentially essential personnel. Probably there will be more information tomorrow, and as soon as we get information, we will push it out through our community networks. Next slide. So this is a snapshot of where we stand in the health district and how many folks have been vaccinated. Our rates are higher for at least one shot. We would like people, of course, to get that full series. And over on the right side of that slide shows you our percentages by race and ethnicity. And it's important to point out that we have done targeted outreach with all of our groups. Our lowest percentage, though, right now of folks that are unvaccinated is in our Caucasian population. Next slide. Next slide. So there are a lot of questions and concerns about the vaccine, and if you have them, please ask. I want to try to answer any questions or concerns that you have. I've got common ones listed on the slides that we'll go through and we'll talk about. And one of them that I hear all the time is I'm nervous about the vaccine because it was developed too fast. And so what I'll say to that is it was developed with speed, but it wasn't rushed. What happened is essentially we put a lot of money into this investment, $18 billion into this investment. And normally for a company to make and manufacture a vaccine and get it to market, a lot of time is spent in fundraising, getting enough money to make this happen. Another thing that's important is internationally, everyone agreed on a research methodology and protocol. Another thing is because so much money was thrown at it and we had agreement in our process, phases were allowed to overlap. One of the things that's important too is when we do medical research, we have to have volunteers. And sometimes that slows us down because people are hesitant to sign up for something new or they don't know what it is. And in this situation, we had people that lined up. We had an overwhelming volunteer response, and we owe all of them our gratitude. The technology that this is based on, it has been around since 2003. Researchers have tried to make vaccines for other things like rabies and Ebola and HIV, and they didn't come to the market because they couldn't make them effective. To be approved, it has to have what's called a 50% efficacy, so it has to keep half the people from getting sick. And the vaccines that were produced with this technology couldn't meet that threshold, but they didn't identify any safety signals with them. And so what's new about these COVID vaccines are they actually put the mRNA in a lipid particle, so in a fat globule, and that keeps it intact long enough to get into the cell. Next slide. So this is more of an economic, So that's a great question. You want me to go faster? Oh, repeat the question. I was like, I'm out of time. When will the vaccine be available for those that are age 5 to 11? And Pfizer just released publicly to the media that they had promising results. We expect that they will submit their application for the EUA to the FDA in the coming days. And then it's a matter of how long it takes for that group to review the data and then make a decision and vote on it. We are crossing our fingers that maybe we'll have it by Halloween, but that's a guess. So more of an economic slide when we talk about how did we get this vaccine so fast is we can make things that are good, we can make them that are cheap, or we can make them fast, but we usually cannot have all three. And when it comes to a COVID vaccine, what we cross off that list is it was not cheap. Okay, there was a lot of investment put in this, an investment that included these companies were permitted to make the vaccine in advance and have it at the ready. So they would not face a financial loss if it didn't get approved. So that meant the day that it was voted on and checked off that yes, we can use this vaccine, it is safe and effective, we could roll it out immediately. Next slide. So a lot of people ask about the side effects, and there are concerns that the side effects are severe. And it's a vaccine. It's a new vaccine, and most of us are going to have an immune response. And so that might be a sore arm. It might be a mild fever. You might not feel great for a day. You might be tired. But I'm here to tell you that any side effect from a vaccine pales in comparison to actual disease. We know that there's the program that we use is called VAERS, Vaccine Adverse Events Reporting System. This vaccine has been tracked more closely than most things I can think of in public health. And one of the things they found, right, was a potential risk for a clotting disorder with Johnson & Johnson. So that tells us a couple things. One is you do not find a 1 in a million side effect until you vaccinate 1 million people. Number two, it tells us that our surveillance system worked. We found it. We found it, and we could identify it, and we could educate patients on the risk. Number three, this side effect is so rare that it equates with the risk of getting struck by lightning. It didn't occur in those over a certain age, and it didn't seem to occur in men. And so we are lucky that in the US, we have 3 very good available vaccines. If you fall in a risk category for Johnson & Johnson where you're worried about a clot, take that to your healthcare provider and talk about it. But it shouldn't be a reason not to get vaccinated against COVID. We have 3 options available. Next slide. So a lot of folks ask this one, right? It was already asked, is does it stop transmission? Does it stop infection? The vaccine is going to prevent most mild infections. As we vaccinate more and more of our population, then more of our cases will be among vaccinated people just from the law of numbers. But our vaccine is working. Our vaccine prevents almost all severe infections, and that is invaluable. And then transmission after vaccination is really rare. Someone described it to me as the Kevin Bacon effect, right? Everybody knows somebody that knows somebody that knows somebody, but in reality, your risk of getting sick with COVID after vaccine is still low. Next slide. So one thing people ask is, well, I had disease, so I don't need the vaccine, and that could not be farther from the truth. If you had an asymptomatic or a mild natural infection, your immunity is likely to be low. Also, the vaccine provides a more broad spectrum type of coverage, so the vaccine is more likely to protect you against what we're dealing with now and any future strains. It's also safer protection. When we put it on numbers, when we first started talking about COVID, we said 80% were gonna have mild disease and 20% were gonna have severe disease that either involved a hospitalization or really acute care, or unfortunately the patient might die. And what we've learned about COVID is it's so unpredictable. And people sometimes wanna roll the dice and take their chances. I grew up in Southwest Virginia, and my cousin, who was in his 20s, died from COVID, and his only risk factor was obesity. And he didn't get vaccinated because he thought he wasn't in a high-risk group. So vaccine is a much safer path to immunity. Next slide. So more people will die from vaccine than from the virus. And I don't know where this originated, but it is not true. The mortality rate for COVID is 10 times higher than flu. The mortality varies, but your vaccine, again, will protect you from severe illness. Some of this comes from people who are pulling the VAERS data down from the public site. Anything we do in government is FOIable, it's all public record, it's there for transparency. But VAERS is a system where anyone can input data. And I say that because last year, a provider decided to test it, and he input a record that said he had gotten a flu vaccine, and it turned him into the Incredible Hulk. And the system accepted it and took it as data. And so when we get all these reports and the data is inputted, folks at the CDC have to clean the data and go through it and verify the reports and records, and that takes time. But there's absolutely no truth to more people are dying from vaccine than the virus. Next slide. This one has also come up a lot, and I know, for young women, this is really important. Your fertility is very important, but there is zero evidence that this vaccine harms fertility. the vaccine encourages your immune system to create antibodies, but it does not affect the reproductive system. Next slide. So more common questions. Will it change my DNA? No. Does it contain tissue from fetal stem cells? No, it doesn't. Do they have microchips? No. They just don't fit in the needle. Does it make the host shed virus particles? No, it doesn't. I'm sure that came about because with certain live vaccines, there's a very, very small risk. This is a different type of vaccine, so you are not going to shed COVID virus if you get vaccinated. Next slide. Next slide. So I've already talked about this. This is a much safer path to immunity. The study that I have there on the bottom is we had an outbreak. It was not in this state, but one of our first pushes was to vaccinate folks in long-term care facilities. Because of all the places that were impacted by COVID, they were hit really hard. And we unfortunately had a lot of deaths in those facilities. And what happened here is an unvaccinated staff member went to work, took COVID back into the facility, and 3 of those residents died. And so when I talk about this, my point really is that vaccine protects you as an individual, but it also protects your community. Next slide. So to go to your question about how many people have been vaccinated will get COVID, that yellow line is the unvaccinated. And it's comparing cases to those who are either fully or partially vaccinated. So the outbreak that we're dealing with is an outbreak of unvaccinated. Next slide.
Not to be political or anything, but all these people coming in that we have no records of, what is that going to do to these stats?
So travelers or just people in general entering the country? Anytime we have mixing of people, right, especially if folks come from an area where diseases are endemic that we don't have here, there's a risk of disease entering. And the example that I was talking about right before we started was measles. And so we know that we have had some measles cases come in brought by a refugee population because measles is endemic in that country. But I've been a field epi since 2003. And every other measles case prior to that was brought in by international travelers, right? And folks in our own country who hadn't been vaccinated that went to another place, got sick, and came back. And so we have systems in place as people enter to monitor for disease. The numbers that you're seeing, and I know that some of the slides you missed because I couldn't put them up there, those are US citizens that are sick with COVID. Next slide. And so this is our rate of death, and the yellow line is the unvaccinated, and it's just another example that our vaccine is working. The folks that are dying of COVID right now are invariably something like 99% unvaccinated. Next slide. I think I've said everything on this slide. This is how we get back to all the things that we want to do. Next slide. And so this is shameless promotion for public health, right? We have been vaccinating for a very long time. And if you talk about public health in general, if we talk about our life expectancy in this country in 1900 was something like 47 years old. And by the time we got to 1960, it was 70. We gained 23 years of life expectancy long before we had any so-called miracles of modern medicine. And how did we do that? We did that through public health, sanitation, separating your water and your sewage. We did that with safer foods. We did that with vaccinations, and we did that with antibiotics. And so between that time and now, we've gained 8 years. What's our life expectancy, Kathy? 78 now. So we've gained maybe 8 years, but our biggest gains came from old school public health. And when we have a new illness in our community, we go back to basics. We wash our hands, we stay home when we're sick, and we get our vaccine. So I'm happy to answer any questions that you have.
Did they not come out with something today new
So probably what you heard is that the FDA approved the vote of the independent committee for booster shots, and ACEP is meeting today. They will give us more guidance. So the question is, can you get the booster COVID shot at the same time you get your annual flu shot? And the answer is yes. You can get those on the same day at the same time. It's the recommendation. Because from a public health perspective, if the patient is there and getting their visit and getting their vaccines, you take your opportunity. If you wanted to do them separately, there's nothing against that either. You would have to go back for your second visit. So we don't have any recommendations or guidance right now. Oh, repeat the question. The question is, when it comes to a Johnson & Johnson vaccine, has there been any word on a booster for that type? And the answer is we don't have any guidance yet on either the Johnson & Johnson vaccine or on the Moderna vaccine. Johnson & Johnson as a company released some information that they had data that said a booster at a certain time would be effective, but it has to go through the same process. And so they'll have to submit data and the committee has to meet and vote. So we don't have any recommendations right now, but more to come, and we'll update you as that comes out.
What about the booster shot and shingles vaccine?
So the booster shot and the shingles vaccine, I do not know the answer to. We would have to get a clinician to get that information. So I'm looking at Kathy to write that down, and we will ask one of our public health nurses or the health director and get that information to you.
What's the best way for us to keep up with what's going on in public health now and what the recommendations are coming out?
So we always ask that you go to trusted sources, or what's the best way to keep up with information was the question. We always ask that you go to trusted sources. You can go to the VDH website, the CDC website. Our local website is rrhd.org. And we also have a community update that I send out once a week. It comes out right now through Healthy Culpeper, but there's a button at the bottom. And if you want to subscribe, if you click that button and put in your name and email address, you'll be added to the list and you'll get the update every week. So once it's approved, the question was, where do you get the booster shot? Once it's approved, the booster shot should be available at all the places the vaccines are available right now. It could be your pharmacist, it could be your doctor's office, it could be your local health department, but all of those places will have vaccine available.
Hi, April. I was just wondering, this is not about COVID, but I was wondering if there's any word on the hiring of the new director for our health district.
So the question was, is there any word on a new health director for Rappahannock Rapidan? And we're all really excited to the thought of getting a new health director permanent position. Right now, Dr. Green is our covering director, and he's over in Winchester. The recruitment is in process. VDH actually hired a consulting firm to take on the process. They did key informant interviews in the community. They're really trying to find someone that is a good fit for us. There have been interviews, and that's pretty much the extent of what I know. I don't have any official announcement to make other than it's in progress.
You have two questions that were submitted in advance for you. The first one is this: is there a possibility of another variant following the Delta variant? And if there is, how would it compare? What's the projection?
So there's two questions in there, and one is there a possibility of another variant? And that answer is absolutely yes. Because like we talked about, when viruses replicate, when they make copies, they're sloppy. They don't make that exact copy, and they can change. The way that they do that is they spread person to person. So as long as this virus is spreading in our community person to person, the chance of a new strain emerging is much higher. So the way to reduce that risk is to reduce our transmission in the community. The second question about what that virus might look like is anybody's guess, right? We don't know the answer. Of course, the concern is that we would have a new virus that is either more transmissible or more severe, but it could also go the other way, right? It could mutate and be less severe and less transmissible. We just don't know. And so what we want to do is control the spread in our community. And the way to do that is stay home when you're sick and get your vaccine.
Thank you. The other advanced question was regarding long-term effects, side effects from the vaccines, and a little bit of how do those get predicted, weeded out, and addressed?
So that's a great question, and it's something that with all of our vaccines, people ask is how do you know what's a long-term side effect and how do you know what's associated? And I'll start with the short-term side effect. And so anytime we do something for a whole population, it's hard to tease out what's happening, right? Because if everybody in this room drank a glass of water tonight, and then we get up tomorrow and someone has a traffic accident on the way to work, drinking the water tonight didn't make you have a car accident, but it is associated by time. And so when we vaccinate large groups of people, we track them over time for any kind of side effect or adverse event, and then we have to compare that with what's happening in the population already. And so when we were talking about the Johnson & Johnson and the clotting event, you have to look at what is your background rate, what is your baseline, and what's happening now. And the question to ask is what's happening after a vaccine higher than your expected rate? So there was a follow-up question in there though. Oh, over time. What we know about vaccines is that if you are going to have an adverse event, they, without a doubt, happen within 6 weeks, usually within 2 weeks. If you're gonna have something happen because of a vaccine, most patients have that within 2 weeks, and the outer limits is really 6 weeks. After that, it's really hard to say that any kind of health outcome would be caused from a vaccine.
And I'm going to say the final question tonight is there anything else that you would like the community to be aware of or to take into consideration that hasn't been covered tonight?
So I think the only thing that I would say, and it's been brought up a few times as I've walked around the room and talked to people, is how did our public health messages become political? And my answer is I have no idea, but they're not. Washing your hands is just a good idea. We know that wearing a mask reduces transmission. We know that distancing reduces transmission, and we know that our vaccines are safe. We know that our vaccines are effective, and we know that our vaccines save lives. All right, thank you.
Again, I'd like to say thank you for April for coming up and speaking. She had so much information to provide, and it was very, very helpful. Just two quick things. Our next meeting for our Combined Neighborhood Watch will be on November the 18th. So normally our meetings are every other month. However, that's going to fall on Thanksgiving, our normal one on the 24th. So please make a note that the next meeting will be on November 18th. The location is to be determined, but we will make sure we send it out email and post it on our Facebook page. And again, thank you for everyone attending. Again, please come back to our next meeting and bring a friend. Thank you to Culpeper Media for doing a live broadcast and recording this for us. And without further ado, the second reason y'all are here other than the food, are the great door prizes. So I will have Sergeant